Is it visible?
Yes, madam.
Okay.
Okay, madam.
All right. Already done.
Yes, madam. We manage.
Okay. So if you've read and understood considering it critical care scenario, please tell me how would you manage this patient?
Uh, after complete history and examination, I will pass the IV line and resuscitate the patient with IV fluid, which is around 80 ml per hour. Along with that, I will take some blood samples, do the investigations, which include urea, electrolytes, complete blood count, LFTs, and clotting profile. And after that, I would like to do ultrasound examination to rule out the reason of the vomiting and the raised liver enzymes levels.
Okay. And
And I'm not sure about the use of antibiotics because he's not having fever or anything.
yes. So no antibiotic. Continue.
Yeah, yeah.
How else are you
And
going
along
to
with
resuscitate him?
I will resuscitate him with the intravenous IV fluid, which is around 80 ml per hour beginning, which is a maintenance fluid, and we'll see the response. And I will pass the foliage to measure the urine output.
Okay. In your opinion, all right, you've received the labs after your management, and you could see liver enzymes are raised and
Yes, ma'am.
urobilinogen was not detectable in the urine test, right?
Yes,
So what would be
yes.
the provisional diagnosis you would consider most likely,
Uh,
in
my
your
my
opinion?
provisional diagnosis in this case is obstructive jaundice or post-hepatic jaundice.
All right. What made you think of that? In what situation
Uh,
or in which situations you would not find urobilinogen in the urine?
when there is obstruction of the bile or the bilirubin to goes to the gut. So I think that in this case it is post-hepatic jaundice, and the other reasons of this post-hepatic jaundice are CBD stones, stricture in the CBD, any tumor obstructing the CBD, or
Okay.
cholangiocarcinomas, pancreatic carcinomas.
So any type of obstruction would result in this. All right. Please
Yes.
tell me, right. Okay. What should be the normal bilirubin levels?
The normal bilirubin level is 3 to 30 micromole per liter.
Yes. Okay. Right. This bilirubin, which is, okay, bilirubin which is found in the blood, in which form would it be? Conjugated or
Uh,
unconjugated?
Mostly it is unconjugated, but a little amount of conjugated is also present in the blood, and it is
Okay.
and the value of that is around 0 to
Right.
0.3 milligram per
Yes.
deciliter.
Yes. Please tell me what is, if you could explain the metabolism of bilirubin.
Okay. Uh, uh, the unconjugated bilirubin is bound to the bilirubin and transferred to the liver. In the liver, it is
Okay.
conjugated by
Before, okay, liver. Yes.
in the liver it is conjugated with glucuronic acid to form by the enzyme gluconide transferase and form the conjugated bilirubin. So the conjugated bilirubin along with the bile pass to the small intestine,
Okay.
bile acids are reabsorbed from the
Terminal.
terminal part of the ileum to form the enterohepatic circulation,
Good.
and
And
the
the conjugated one. Yes.
rest of the conjugated bilirubin pass to the bowl, large bowl,
Yes.
in the presence of the bowl bacteria, it is deconjugated and form the urobilinogen. And the urobilinogen is oxidized to form the stercobilin, which gives a characteristic specific brown color to the
Yes.
feces.
Very good.
And the 10% of the urobilinogen is again goes to
Right.
the enterohepatic circulation and goes to the
Thank
liver,
you.
and
Yes.
some part of the urobilinogen is also goes to the systemic circulation to excrete into the urine.
Very good. Thank you. Please tell me what are the different types of jaundice that you know of, or how would you classify the jaundice, the different types
We classify them
broadly?
prehepatic, hepatic, and post-hepatic jaundice.
Yes, please
And
give types.
prehepatics is hemolytic anemia, which includes sickle cell disease or GCP
Okay.
deficiency or Gilbert syndrome. Hepatics are due to alcoholic liver disease, viral hepatitis, or due to some medications or
Yes.
autoimmune hepatitis, and the
Thank you.
post-hepatic are yeah.
Yes. Please tell me what are the functions of bile salts, especially in case of digestion of the fat?
Bile salts are very important in absorption and the digestion of the fat. They basically emulsify the fat into micelles and increase the surface area for the action of the pancreatic lipase enzyme.
All right. Okay. These bile salts, they are conjugated in the liver by, what are the name of the
Enzyme?
enzymes or the structures? I want you to tell me by two structures which help in conjugation of the bile acids in the liver. And there are two types. If you could tell me the primary bile acids and the secondary bile acids.
Yes, ma'am. There are two types, primary and secondary. Primaries are glycolic acid and chenodeoxycholic acid. And the secondary bile acids are deoxycholic acid and lithocholic acid.
Yes, on the basis of what are we dividing them, or we calling them primary and secondary? If you can tell me that.
We divide them on the basis of their formation. The primary was
Synthesis.
formed directly from the liver, from the
Liver,
cholesterol,
yes.
and the secondary was formed by the action of the bacteria on the primary, and
In
they
the
lead to form
colon.
the secondary bile salts in the colon.
Yes, in the
Yes.
colon, yes. All right, good. Please tell me now that you've received these results, what would be your next step? What investigations would you ask for now?
Initially, the radiological investigation, I would like to ask the ultrasound.
Okay, and
in the ultrasound, I will like to see, is there any intrahepatic or extrahepatic biliary dilatation, or is there any stone in the CBD?
yes.
And for example, if there is a stone in the CBD, I would like to do ERCP.
All right. Why would you go for ERCP and not MRCP?
I think ERCP is both diagnostic and therapeutic. So
Very
at the
good.
same time, we can diagnose, and at the same time, we can retrieve the stone as well.
Okay, very good. At the same time, you can do both. Okay, when you're considering the lab results, please tell me
Yes.
why ALP or ALP and this one, what is this, alkaline phosphatase or the
GG.
gamma glutamyl transferase, which one is more important
Yes,
and
ma'am.
why?
These two,
Among these two,
yes, ma'am.
which
I
one is
think
more important
GGT,
and why?
gamma glutamyl transfer is more specific for the biliary obstructions.
Very good. Yes.
Because ALP is also raised in case of like bone
And
tumors, and
yes,
as well as in placental,
yes, yes.
because it is found in bone and placenta. I think gamma glutamyl transferase is more specific for the biliary obstructions.
Okay, this gamma glutamyl transferase can also be raised in case of people who are chronic alcoholics. Then how would you differentiate, or how would you determine the cause of obstruction? Would you be able to, or is it's not possible?
Maybe I will come later on this question.
Okay, good. Time. Okay, right. When would you determine that patient now needs antibiotics?
When there is a fever,
Yes.
when there is increasing pain. I
Yes,
think
when there
these
is
are
fever, in case of
when there is a fever.
cholangitis.
Yes, ma'am.
Yes, all right, good. Thank you.
Thank you.